my name's Melinda Herzog, and I am the coordinator of the Healthy Ulster Council. Welcome to today's meeting. We have a really great slate of speakers. We have time to do some networking. We're going to role model healthy meeting behavior. We got a lot to do today, so we're going to get going. Welcome, everybody. We're just going to go over a few things. First of all, I'd like to have our meeting hosts introduce themselves as well. So I am, again, Melinda Herzog. I work at Cornell Cooperative Extension. I'm the Healthy Communities Program Leader there, and I do coordinate this council. I'm working in partnership with the Ulster County Department of Health and Mental Health. And Vin, if you could just introduce yourself. Just remember, you got to unmute.
Hi, Vin Wattel here, Director of Community Health Relations, Ulster County Department of Health and Mental Health. Hi, everyone.
Awesome. And Stacy?
Hey there, Stacy Kraft with the Ulster County Department of Health and Mental Health, Public Health Education Coordinator. Thanks for joining us today.
And Katie?
Oh, hi, I am Katie Sheehan Lopez. I'm the SNAP Nutrition Educator at Cornell Cooperative Extension.
So these, all of us are today's meeting hosts. We're working together on the tech and managing the meeting, and we welcome all of you today. So a few housekeeping issues to go over. If you are new to Zoom, just a few little instructions. If you look to the left here, your audio is down here on the bottom left of your screen. It will look like a microphone when you can talk or when you have audio, but you want to keep it muted for the meeting until it's time for networking. And we'll go over the reasons for this and how we're going to manage questions and that sort of thing. Your video is also right here. It's wonderful to see your face, but you know, if you have internet issues or that sort of thing, feel free to stop your video. But it's always great to see everyone in the meeting. So it's lovely to have you turn it on. And then, I gotta move something that's in my way. So there we go. So participants can also give the thumbs up or the thumbs down. There is a chat box. The first thing I'm going to have you do as we go over housekeeping is put your name and organization in the chat box. That's how we see who's here easily for perpetuity. We can kind of get that. And you also introduce yourself. So say hi in the chat box. Say hi, I'm, so I'd say, hi, I'm Melinda Herzog, and I put Cornell Cooperative Extension there. So go ahead and do that and get that in there. And up here on the right, there are options for viewing. You can select how you split your screen, how you see all of us people. You can play around with that a little bit. It's not going to harm anything, so go for it. There we are. So let me just move us to the next screen. So these are our housekeeping details. The first one, oh my gosh, I actually went like this. So we do have some housekeeping details. Please, again, say hello by typing your name and organization in the chat box. Please stay muted throughout all of the presentations. You are going to ask your questions in the chat box as well. And at the end of the presentation, we will read them and get answers to those questions. There's just too many people to see who's got their hands up and who's talking and whose turn it's going to be. So that's the easiest way to handle questions and keep us going. So we're going to do that. There we are. If you have any questions about that, let me know. Uh-oh, my screen isn't advancing. That's never a good thing. So let me make that, there we go. So here's today's meeting agenda. So we have for today, the introductions we just went over. We have 3 presentations. The first one is making every moment count. And this is an overview of the Hudson Valley Hospice Services. We have Sophia Sciacca here. She's going to be presenting. We also have COVID testing in Ulster County. We have Hilary Harvey from the Ulster County Innovation Team at the County Executive's Office. And we also have a Get Out the Census presentation where we're going to share resources with you to help with that. And that's going to be presented by Kleinhans from Cornell Cooperative Extension. We will then have a movement break. It'll be very brief and painless, I promise. And it'll be primarily in your chair. It's just we always demonstrate healthy meeting principles at all of our Healthy Ulster Council meetings. So if we were in person, we'd definitely be having a healthy snack. But even as I sit here, I have my water. And we would also take a movement break if you haven't been to one of our in-person meetings, and we'd still do that in our Zoom meetings. And then we will have a facilitated networking session where we will give you an opportunity with some guidance to share very briefly a program or an event that you have coming up for your organization. And we'll have some instructions on that as well. Yes, but we're going to go on to the COVID testing in Ulster County presentation. Hilary's part of the Ulster County Innovation Team for the Office of the County Executive. So I'm looking forward to your presentation.
Thank you. Thanks so much for inviting us too. So yeah, the Ulster County Innovation Team is an initiative of the Ulster County Executive's Office and kind of a newer department. And we're kind of describe ourselves as a special projects team in some ways. So, you know, I actually started at the county in January, and I think maybe 5 or 6 weeks into my term at the county, COVID happened, and we were put on the project of helping Ulster County Department of Health and Ulster County government set up a COVID-19 hotline to address any kind of questions that the constituents may have, or, you know, just to be sort of help alleviate some of the pressure that Ulster County Department of Health may encounter through unprecedented call volumes. So the Ulster County COVID-19 hotline was launched on March 11th, just 3 days after the first case of COVID was announced in Ulster County. And we actually we started out in the Department of Health conference room and quickly discovered, as we all learned through the pandemic, that working in a single room environment was not the best way to practice social distancing and everything that we were learning about COVID and how it was transmitted. So we moved to remote operations March 26th, and we had a team of about 16 county employees working from home and coordinating online. So as we entered the phase of reopenings this summer, through the governor's New York on Pause and New York Forward state mandates, we pivoted the county's COVID-19 hotline to an Ulster County Recovery Service Center, focusing on how the various needs that our constituents may have as we move into hopefully a more recovery aspect of the pandemic. So that was announced on June 11th, and we have about 17 county employees who have been nominated by their home departments to an RSC fellowship. We call it a fellowship program. It's leadership development. And you can see them here in this picture with the county executive. I don't know if you can see my mouse. And so over the course of about 185 days of call center activity, we've received about over 28,000 inbound calls, and that's resulted in over 10,000 service requests. And so what we do is we connect county government, county services and programs and departments to the county residents who are calling, as well as to businesses. We collaborate closely with the county's contact tracing and data teams. So if you've seen some of our data tracking on the county's website, that comes from a data team that's analyzing all of the statistics that come in from the state. We also educate Ulster County businesses and individuals who may have received New York on Pause complaints. New York on Pause is the mandates that help align New Yorkers with healthy practices around the pandemic. And so we do take in those complaints and then call the businesses and individuals if they've been traveling to a restricted state or something like that, and just talk to them about the guidance to make sure they understand it and see if they have any questions about best practices. And then finally, one of the things that I'm here to talk about today is that we maintain an up-to-date database of diagnostic and antibody testing options that are available throughout the county through 9 private COVID-19 test partners. So while the county launched 3 mobile test sites, it was in partnership with those medical providers who were in charge of running those, obviously, because they are medical professionals, and so that's their milieu. So there is kind of a misunderstanding sometimes that the county is running the test sites, but really we're partnering with medical practitioners who are running those test sites and helping to facilitate their operations in whatever capacity we can. So a little bit about COVID testing. Their diagnostic test, which is, and maybe some of you as health professionals already know this, so forgive me if I'm reiterating anything, but for anyone who doesn't know, and it was all new to me, diagnostic testing is a molecular test. You've seen kind of the illustrations of going through the nasal cavity to the back of the throat, the sinuses, to gather a sample to test for the presence of coronavirus in the body. Samples can be taken, collected by a doctor or self-administered. A lot of our pharmacies do the self-administering nasal swabs. They'll give you a swab that's not quite as long, and then you use it yourself. So a positive test result is reported to the state and also to local health department contact tracing teams. That helps us to gauge that database of activities and keep track of our dashboard. COVID-19 incubation period is 2 to 14 days. So it's really important to remember when people are getting tested that any test result is really a point in time indicator. So, you know, a negative test result, oftentimes you might still be advised to quarantine or self-quarantine by your doctor, medical professional for a full 14 days after any any exposure you may have had or symptoms. And finally, about diagnostic testing, rapid testing is limited in its availability right now in our area, and those results are not reported to state and local health departments. So it's a little bit hard. That's kind of a developing field, I think, in COVID-19 testing, and I think you know, part of the hurdle to get through is how do we bring in rapid testing where you can get a result in 15 minutes and really know, even if it's not as reliable as a molecular test, you know, just to have a sense of in larger settings who may be positive for COVID-19. How do we then translate that to our state and local health departments through reporting? So that's an avenue that we have to look at. And then there's also antibody testing, which is a blood test, and it looks for the presence of antibodies in the body. A positive result means that antibodies from any past infection were detected. A negative result means antibodies from the virus to the virus were not detected. But antibody test results don't really tell us whether someone is currently infectious. So you may sometimes get an antibody test and then be advised to get a COVID diagnostic test to determine if you still have COVID-19. So the other piece of this is that we're not really certain how long and if antibodies will protect patients from future COVID-19 infection. There's been cases where people seem to have been reinfected or had the presence of the virus in their bodies for long periods of time. So that's an area that's still being studied. So in terms of our test sites, the 9 test sites in Ulster County, in the absence of any kind of standardized testing model, all of our 9 facilities and providers in Ulster County have determined for themselves what works best for their facility to provide COVID-19 diagnostic and antibody testing. So each facility will determine whether a doctor's order or prescription is needed, whether an appointment is needed, whether ID is needed, or what forms of ID are accepted, the hours of operation. Oops. So what we've done at the Recovery Service Center is we've created a database of our testing partners, and we check in with them weekly to figure out, if anything's changed, what their current capacity levels are, any updates they want us to know or want the public to have access to. Oftentimes callers will call and ask, new questions recently have been about whether or not people could get their children tested. So which test sites test people under the age of 18. So we update our database weekly through our partnerships and our contacts over at the test sites. A lot of times COVID-19 diagnostic testing is covered by health insurance, but a lot of times there is a doctor's visit or telemedicine visit, telehealth visit that's required. So a doctor's visit could incur a cost. Some test sites will bill for uninsured patients. So if somebody doesn't have insurance, they can sign a letter of attestation, and the testing site can submit the bill through the CARES Act, the congressional bill for aid through the pandemic. But I think the most reliable way to get tested for free is at a state-run mobile test site, which is available locally downstate in Harriman State Park and up north at SUNY Albany. There have been questions recently about sites that could accommodate patients who prefer Spanish, and there are many sites that have Spanish-speaking staff both at the collection site as well as on the phones. There's also phone menu options when you call to schedule an appointment, and there's also interpretation services for from some medical providers. The key thing to remember also when people are getting tested is if someone is symptomatic, it's really important to call the test site ahead of time, because there are certain protocols for testing people who are potentially displaying symptoms or are potentially infectious with COVID-19, so that we can protect our healthcare providers and people in the waiting room and things along those lines. So just some FAQs. Diagnostic test samples are processed by labs, and then the results are sent back to the ordering doctor. So a lot of times that's a big question that we get at the Recovery Service Center. How do I find out my test results? And sometimes people call the Recovery Service Center looking for their test results, but because of HIPAA laws and because we don't have access to it, we're not necessarily an exact arm of DOH. We just coordinate with our partners in DOH. We don't necessarily have access, and we couldn't give the information anyway. So we always send people back to the ordering doctor or to the test site facility. And test result turnaround time really depends a lot on capacity. And this is where, as a county, as a nation, globally, these are things that we have to think about in terms of the pandemic. The test sites have a certain level of capacity. There's only a certain number of commercial labs that are doing the sample processing. And then, so their turnaround time is a factor. The ordering doctors then have to get back to the patients. The patient portals have to be updated. And then there's always increased demand depending on the situation. Kids go back to school and there's, a flood of people who need testing. If there's an exposure event or a campaign to get people tested or get workplaces tested, that will all affect turnaround result times. So we did a project where we sort of asked the test sites what their turnaround time is. And it does vary week to week. As you can see, we kind of charted it over the summer. And, it seems to be getting, it's just variable at this point. The other thing is that diagnostic test results are reported to the state and local health departments. And if someone if a positive test result is reported, that'll trigger state and local health department contact tracing teams to conduct investigations and issue any quarantine and isolation orders. So that's, a patient who tests positive will be, in touch with their doctor, they'll be in touch with local health department, and they'll be asked to isolate and they'll be asked about their direct contacts, and their contacts will be contacted to be asked to quarantine. We're defining direct contacts within 6 feet for 10 minutes or more. So that's kind of how the testing phases into the contact tracing efforts to isolate and trace. So the test sites in Ulster County, and you can find this information on our virtual center. The county has a COVID-19 website and a drop-down menu for testing, and then you can choose COVID-19 testing or antibody testing. That's where we list all the general information about all of these various test sites. So there's Emergency One. New Vance Health Quest used to provide mobile testing at Tech City, and then they moved in June to distributed operations throughout all of their offices. So if you are in that network, you could go to your doctor's office and get a test. And then they also have an urgent care center if you're not a current patient of New Vance Health Quest, and that's in the Hudson Valley Mall in the town of Ulster. Our Grand Street mobile test site is still operating. That's in conjunction with Westchester Medical Center. That's in Midtown Kingston. You can walk there, you can drive there. You don't necessarily need an appointment. You can have an appointment. They're very accommodating, and they take all forms of ID, including foreign ID from other countries if somebody is an immigrant and doesn't have American forms of ID. And then we have some, pharmacies who do the self-nasal swabs, Rite Aid and CVS, and you just make an appointment online through their websites. First Care Medical just recently started offering testing, and they're doing it like a drive-through, kind of in the back of their facility. You drive into their parking lot and wait by a telephone and pole, and then somebody comes out and takes the sample. And Caremount is working on reopening their Kingston office. I think their Kingston and High Falls offices were closed during the pandemic, and they've been working out of Rhinebeck and Poughkeepsie, but Caremount patients can also access Kingston coming up soon, I think potentially in October. So lastly, you can find the general info. Oops, sorry, I'm a little new to this screen sharing stuff. So you can find general information on the county's virtual center 24/7. We also have a chat bot, so you can discuss online through chat with the bot. That's covid19.ulstercountyny.gov/get-tested. Or you can talk through our more extensively detailed database where we can talk to you about, Spanish language options. We could talk about forms of ID that are accepted. We could talk about hours of operation and various locations. Any kind of questions people have about getting tested. The Recovery Service Center is open Monday through Friday, 8 a.m. to 5 p.m., and we stay open late until 7 on Mondays and Fridays, and our numbers posted there. So these are a couple of our research team. We've got Ashley Litz, who is one of our main points of contact with our test site providers, and Sharon McKenzie, who's an excellent researcher, and they both work full-time at the Recovery Service Center as fellows.
Thank you so much. That was a lot of information. I think it's information that is very important to hear for all of us, as we good many people that are here work with a lot of people in Ulster County. So to be able to have accurate information to share is what we were looking for, and you delivered it. So thank you very, very much. What I would like to do is invite folks to put questions in the chat, and we'll entertain about 5 minutes of them and see if we can get through that. So if anyone has questions to share, please type them in. Feels like a telethon.
The research, I'll tell you, the research aspect of, connecting with our test site partners just kind of happened was born of curiosity in a lot of ways, on the part of our fellows. They were getting questions from the public, and a lot of the information that we gather and provide to constituents is really generated from questions from the public. We're finding that Ulster County residents ask amazingly informed questions. They are really up on the ball, and they always challenge us. So it's a lot of fun to try to find out the answers to their questions, and part of that, coming up with this spreadsheet database of test site options and all the different parameters that we're tracking on a week-to-week basis really comes from our constituents' questions. So we're always grateful when people call.
Yes, thank you so much. As I said, I think what I'm seeing here is great work, great presentation. Thank you, Hilary. Excellent presentation and work. I think that your presentation was very, very informative and really answered a lot of our questions. This has come up in many of our meetings. I'm seeing some thumbs up on the screen, and this certainly was a great deal of information, and now everyone has a good idea of where to look for it as well. And we will, with your permission, post the PowerPoint as well. On the
Sure.
Healthy Ulster site, and that will be another resource for people to look at.
That would be great.
Yeah, thank you. Thank you
Thank
again.
you for having me.
Yes, absolutely. So we're going to return to, I think, Sophia Sciacca to see if we can, it looks like I was watching her. It looks like your internet is improved. You're not frozen anymore. So I'm going to share your PowerPoint. Make sure you unmute yourself so I can see you. And we'll go back to that presentation.
I apologize. I do believe that the issues are on my end. So I'm actually, Melinda, going to try to go a little quicker in case if we run into technical issues again. So getting back to kind of where we left off, and the word hospice does have meaning. It goes back in time to being a place where people found a little bit of respite before they continued on their journey, and that really is the whole concept of what we do at hospice. A little bit of history, more recent though, is during, there are three very dynamic women who were really very much a part of hospice today. Starting back during World War II in England, there was a woman, Cicely Saunders. She was a doctor. She observed how those who were in London after the war, how they were being treated and cared for, and felt we can do a lot better. And she is what we call the mother of the hospice movement, who started a hospice hospital in London called St. Christopher's Hospital that is in existence to this day. Jump to the 1960s, Dr. Elizabeth Kubler-Ross wrote a book, very powerful for the time. It made people think about, dying in a different way and understanding, the stages of dying. That really opened people's eyes. The idea of hospice continuing to this side of the United States, in Connecticut, another dynamic individual, Florence Wald, opened the very first hospice setting here in the United States, and that's in existence to this day. During all this time, our government was observing what's going on with hospice. How is it helping? Is it helping? And is it helping us save money? Which is, of course, our government's always looking at the money. And they, through a number of research, a lot of studies, realized hospice has value. Hospice has value to the recipient, to their families, their support group, and made the hospice benefit a permanent Medicare hospice benefit in 1986, which means for those who are on Medicare Part A, they receive hospice is paid for 100% and all of the services thereof. And we are Hudson Valley Hospice here in we serve all of Dutchess and Ulster County. Okay, so in short, people say, you know, what's the difference between palliative care and hospice care, and aren't they the same? Think of a ruler, and the ruler represents palliative care, which is, you know, symptom management and taking, you know, helping people who have a chronic illness and focusing on the quality and comfort of life. But within that ruler, there's a portion of that, we'll say a quarter of it, is hospice care. So hospice is specialized palliative care for end of life, and palliative care does not necessarily equate to the specialized palliative hospice care. So if people do ask that question, sometimes that you know, can help differentiate. If you have you know, the need to go to a specialist, you would go to a cardiologist. You wouldn't just go to a general practitioner. You know, think of hospice in that sense. And we can go to the next slide. In terms of who do we serve all ages, literally from newborn to, we've had individuals who are 103. And in terms of illnesses and location, we'll go to the next screen. All illnesses, there was a time when people only associated hospice with cancer. That is not a reality. Cancer is one of the many illnesses that we help for those who are, you know, at end of life time frame. People have received hospice care who have COPD and heart diseases, renal failure, Alzheimer's, dementia, Parkinson's, any life-limiting illness for which there is not a cure, and that there is a, you know, a diagnosis of 6 months. Please note that a diagnosis of 6 months does not mean somebody necessarily is going to, you know, die within that time frame. Oftentimes, people who receive hospice care, the quality of life is such that they do live a little bit longer. The statistics have shown that. Next screen. So in terms of, you know, where do we serve? You know, it's any location. Hospice service, hospice care comes to the individual no matter where they are, whether that's a private home, a hospital, nursing home, and you know, a group home. I will also stress that because of the partnerships and the referrals that we receive, not only from individuals referring themselves or from the hospitals, but from social workers and care managers who work with individuals, we've been able to help others. And case in point here, a few years back, there was a social worker working with, in the community, working with somebody who was homeless. And she wasn't sure if somebody qualified or not, but called us through a lot of phone calls and conversations where we were able to, she was instrumental in making this able to help individual with our hospice services because she was able to have that individual inside the homeless shelter. So we do what we can to meet somebody to make their lifetime
Can't hear her. So I'm just going to say that once again, we're still getting some feedback from your internet.
Okay.
Can you just,
Melissa,
without me sharing the screen, can you just give us a quick, you know, overview of
what if you overall? It's we are there to serve. We have because we have grown so much here in Hudson Valley, we are now providing palliative care. That's brand new. I think we even had a you know, some information out about that. The very last screen, Melinda, has my contact information, and I know, you know, we'd be rushing through, but just overall, the care that hospice provides is not just for the individual. It's for their whole family unit, whatever that unit should be, because we believe nobody should die alone, nobody should die in pain, and there's a whole support system that allows people to stay home, wherever that home is, and you know, have that sense of quality of life. We are there for the veterans and making sure that they have their benefits as well. But our social workers, our music therapy, there's so much to hospice that until you've had a loved one who's received the services, you don't realize the breadth of services that we are there for. But I know without, the screens, the very last screen does have my contact information if anybody has any information about that. But I guess in a nutshell, I'll leave you with the one, quote that we, in terms of hospice, which is Maya Angelou, who said that people will forget what you said, they'll forget what you did, but they'll never forget how you made them feel. And that, in a little nutshell, encompasses hospice. It's what we do for the individual, whether they're in a nursing home or they're at home or they're, they live, no matter where they live. But if you're not sure about somebody that you know or a family member, I always say, just give us a call. It doesn't hurt to find out, a call of inquiry. And if it's not the right time yet, then at least that little bit of fear factor is broken. Sometimes just making the initial call of like, oh, okay, I didn't realize, gosh, that wasn't so hard. And maybe it's a lot of, in reference to many of the services that we have. It's always hard for somebody to make that initial call of inquiry. But no, my contact information is there. And if anybody can't see any of the things, I will send information to Melinda and she can email everybody.
Yeah, Sophia, you can also put your contact information in the chat.
Oh,
You
sure.
can just type it right there and everybody will have it.
Okay.
I'm going to say that, and I think I'm going to turn your video back on just because I think that really did have more to do with, actually, for whatever reason, I can't seem to get to that button. Maybe Katie, you can help put her video on while she's talking, just so we can answer some questions. But
Okay.
obviously, one of the things that I learned from your presentation is that, we always do think of hospice generally as a service for, really in those last few weeks of life. And it's very clear that, you provide so much more, really that palliative care for an extended length of time when someone does have a terminal illness. And, it would be good, maybe, I think one of my questions is, are there costs associated with that? How does that get paid for?
That's an excellent question. So number one, hospice is covered 100% for anybody who receives Medicare Part A. Secondly,
Okay.
Hospice is covered by Medicare. It is covered by many of the insurance companies, HMOs. For somebody who does not have sufficient coverage or does not have coverage, we have our Hospice Foundation, and that is there to help those who they can't do it. And so we are able to reach out and help individuals regardless of their coverage, but it is covered 100% by Medicare Part A and by some of the other, it's covered, by other means as well. And one thing that is key, that what you said, reaching out and calling hospice. We're not there just for the end stage of life, which is what we call a late referral. End of life can encompass a year of someone's life. It's not necessarily the last couple of days. And often people will reach out to us not realizing that what's covered by hospice are the medications, are the DME equipment. Sometimes we have gone into a home and the family is so sad, paid for their own oxygen or paid for their own medication or the hospital bed. That's something that we provide free. And that's, part of our services, the medications, and removing some of the medications afterwards. So, there is a lot to hospice that people don't realize. And, sorry, my talk got interrupted there, but the pay is a good question. People ask that all the time. And, people also, I always say that at the end of my presentation, if your doctor hasn't asked you about your end of life wishes, put them in the seat and ask them, why didn't you ask me? Because you don't want to be in a position where I never thought of this before, which is natural. We don't think of end of life. It's not, top on our mind until something happens. But like anything, it's like, at least have some thoughts about it. But if you know somebody who, or a family member, it's not always comfortable to ask the questions, but at least inquire about hospice. because the supports that can be provided, even in a nursing home. People say, why a nursing home? Well, we have our music therapy staff that will go into a nursing home setting, provide the therapies there, and it's just additional level of support. It's not taking away from, it's adding to. So it's an added value. But thanks, Melinda.
Thank you so much. Do we have any questions? There's still, one thing I know for sure is everybody's asked for your contact information. So if you could put that in the chat, that would be great.
Sure.
The website for hospice was shared on the agenda, so I will put that back up as well. But do we have any questions for Sophia? It was a very good presentation. Technology issues notwithstanding, there's a lot of information.
The tech issues were on my end, so I apologize for that.
It doesn't matter whose end it's on. We all have it happen. So this is part of being online. So we just manage it. And I think you got your information across very well. Any other questions? Okay. Well, thank you very much, Sophia. Again, visit the hospice site. If you could put your website in the chat and also your contact information, I think people would appreciate that so we can learn more about the services. It is an organization that I think is shrouded in we all have a certain thing that we think about with hospice, and you do so much more. So thank you again.
Oh, thank you.
I want to move on to, we have another short presentation from Tara Kleinhans. I just want to share really quickly. We'll move on. Get Out the Census, presented by Tara Kleinhans at Cornell Cooperative Extension of Ulster County. So Tara, I'm just going to hand it right over to you.
Thanks, Melinda. Let's share this screen here. Can you see that?
Yes.
Okay, great. So Cornell Cooperative Extension is helping to get the word out about the census. There is a lot of information translated into multiple languages. I put both English and Spanish here on this first slide. Let me move on here. So what is the census? The census is mandated by our Constitution, believe it or not, and it happens every 10 years. It guides our federal funding, for instance, libraries, parks, schools, nonprofits, and much more. And essentially, it takes population data and decides how many officials in each state are appointed to the House of Representatives, so that's really important to know as well. Who should be counted and where? So if you have resided in the United States as of April 1st this year, then you should be counted. There are lots of questions in regards to who, such as if you're in the military, if you've moved for college, if you had a baby, if you're homeless even. So all those questions can be found on the Who Should Count page, all the answers to those questions, I should say, and there's the link to that there. How can you respond? This year is the first year that the census has been made available online, which makes it really, really convenient if you have internet, but if you don't, you can also respond by telephone or mail. And as I mentioned before, it's listed in numerous languages. There's multiple telephone numbers depending on which language you speak. And it is important to note that the census is a nonpartisan government agency bound by law to keep your information confidential. Your information is kept anonymous, and it really is just used to produce statistics. There have been instances of scams. The census does not ask about your citizen status. I know that was a big question this year. So it does not ask that. It doesn't ask for your social security number, for money, anything having to do with politics, or your credit card number. So if you do come across that, that's not real, avoid that. And how are we doing in Ulster County? I find this really interesting. The map is updated every Monday, and you can search by state, by county, by city. So overall, this is our self-response rate. We are 60% in Ulster County, which is just behind the New York State percentage rate at 62. It does not include the percentage rates from the door-to-door census workers. So we're actually up to 88% of the total US population. If you want to find out more information about this map, you can visit this link here, 2020 census response rates. My presentation is very quick. So this is the end of my presentation. The deadline is September 30th. So please share this. It takes 10 minutes. It's 10 questions, and you can support your community for the next 10 years. So please spread the word. I do think we are sharing some materials that you can spread on social media, but if you would like some content, please feel free to reach out to me. I'll give you some content to share. And there is a flyer specifically made for the health industry that has messaging specific to that. Are there any questions?
So I actually have a question for you, and that's that you do have materials to share. Is that something that after this meeting we could send out to everyone at the meeting?
Sure.
And how, I know that there was a flyer or a couple of things that were ready for social media that people could use in their own organizations, if that's shareable. So that'd be great. We can certainly do that. Do we have any other questions for Tara? I think it's really important that the word on this gets out and we get as many people to complete the census as possible. I know that I was in a meeting last night with the town of New Paltz. They were happy their rate of return was somewhere around 50%. Don't quote me on this, but you know, they were like, but we still have to get it higher. And I think that's very clear for all of us. We have to get as many people to fill this out. So as organizations, the more information we can share on getting people to complete the census and really getting people to participate is so important to the funding that comes to our area. So we will share a few resources that you can kind of just put on your social media or get on your website. We really want to get this information out there and make sure that people are completing the census. The data is really important. And I know as organizations, you guys are always looking at the census data from the last census as we look for data. And this is something that really, you know, is of so much importance. Okay, so, and I have a comment here from Vin, who said New York State can also lose congressional representation if we're undercounted. So that's also a very, very big reason to make this happen. I mean, this also affects how we're governed and what we have to say in government by our representation if we don't have enough people. So we wouldn't have enough delegates then. So if everybody can kind of help with that, we will share information and resources. And I thank you so much, Tara. All right, so we're going to move on to our facilitated discussion. And this is where everybody does get a chance to share. So I just want to be sure that we go over our rules. So we're going to briefly share our organization's upcoming program or event. What I'm going to do as your facilitator is I'll call upon you to share. You're just going to briefly say who you are again, say your organization, just so we remember in case we haven't met you before. And then you get a chance to share an upcoming event or program that you'd like everyone to know about. Now, this isn't a time to share everything about your organization. Try to focus on an event or a program you want to highlight and make sure that, you know, you've got it succinct, you know what you're going to say, and it's brief, because we've got 25 people that want to share today, and we have about a half hour left. So you can also share details like your website or other things about program, like your dates that you have coming up or how to contact you in the chat. That's also there for you to share. So you're briefly going to state something, but then you can also share more information in that chat. So I'm going to go through right here and pull your chat screen up, everyone, too. Make sure you've got that up because more information will be coming on that. So I'm just going to go left to right on my screen. It may not look the same on yours, so I'll just call you out. Remember, you might be on mute. feel free to start your video again. It'd be great to see everybody's face for this so that we can see each other. So Colleen Jones.
Hi, I'm Colleen with the Mid-Hudson Problem Gambling Resource Center. Just a few things. We have our annual conference coming up on October 8th and 9th. It will be virtual. We're doing 20 hours for $20. And we will have OASIS credits, CEUs, and that will include credits for LMHCs, which is the first time we've been able to do that. So we're very happy about that. So not just social work. We also are having a statewide screening day for problem gambling on September 22nd, and we would love for any organizations to participate. It's just 3 questions to add to your normal assessments or intakes for your organization. And then finally, we are continuing to provide treatment services to anyone struggling with problem gambling. So I will put my name and contact information in the chat, and we are still doing education. So we're doing trainings that we have as well that are also eligible for OASIS and CEU credits. So if any organization is looking for some training for their staff, we can provide that.
Good to know. Thank you. So Zach, just remember to unmute yourself.
Hello, my name is Zach Peterson Bernhard. I work with Gateway Hudson Valley. And I think the thing I want to share is we have a new service that we're offering. So I am a certified peer specialist with the state of New York, and we are starting to have peer services at Gateway Hudson Valley. They're not fully up and running yet, so we have a little bit of ways to go, but while we're building the infrastructure for that program. But I did just want to put it out there to anyone who is a provider agency or someone who might be referring. We are offering that service, and even though we're not entirely up and running yet, you know, if you did want to contact me or if you had a referral, you know, feel free to reach out to me or to Gateway.
Thank you.
Thanks.
Geneva.
Hello. I am the new community health manager for the Maternal Infant Services Network in Ulster and Sullivan County. So I'm very happy to be here, and thank you all for, you know, letting me join your meeting. We do have our community health worker who is on the call as well, Lynette Vargas, who is usually based in Sullivan County, but is also, especially during COVID times and virtual working, is able to work in Ulster County as well. We have a baby cafe coming up, and I will let Lynette give a little bit more information about that. And we also have services through our insurance navigators for women in the area that might be in need of connecting with insurance services. So that's quickly a few services that we have. And like I said, I will let Lynette talk about our baby cafe event when it is her time.
Okay. Well, I'm going to go right to Lynette then, so you can follow that up. Just remember to unmute. There you go.
I'm Lynette Vargas with the community health worker with Maternal Infant Services. With our baby cafe, we usually have Mondays twice a month. So it's every other Monday from 10 to 12. Usually the first hour we have is for anyone who's English speaking, and then we try to have the second session, the other half for Spanish speaking moms. But you can join at any time, and it's open to the public as well, not just our clients. So, you know, anyone can join we've been having anyone from Sullivan, Orange, and Sullivan County join. The community health worker, just, you know, getting connected the women to a lot of the resources in the community.
Great, thank you. And do remember, you can put your dates and information in the chat as well. Keith, can you share?
Hi, my name is Keith Fergie. I'm the systems advocate at RCAL, or the Resource Center for Accessible Living in Kingston. We serve mostly Ulster County. We have a lot of services, special education advocacy, service coordination. Our main goal is to try to get people to live in the community as independently as possible and out of institutionalized settings. We're one of 20 or 30 independent living centers across the state. We don't have any upcoming events that I know of. We're very compartmentalized. I do a lot of political advocacy at the state and local levels. But that's kind of it on my end. Just, you know, get out the vote. I guess the deadline for registering to vote is October 9th. That's something that we're trying to get people registered to vote. And that's about it for me.
Okay, thank you. And remember, you can share a website or more information in the chat. Jessica Canada.
Hi, I'm Jessica. I'm the reality check coordinator with the tobacco-free action communities for Ulster, Dutchess, and Sullivan. We don't have a whole lot going on right now. We're collaborating a lot with our state partners for, upcoming things, but it's been a little quiet. And I started at the end of June, and with Reality Check, we work with youth. So it's also been very quiet with school being out and it being summertime. But I'm definitely open if you have youth that you work with in any of those 3 counties. I would love to chat with you. And the one thing that we do have coming up that I know, we have Seen Enough Tobacco Day, which is October 13th. So we're going to have that whole week, we're going to have some different activities for youth to be a part of. So I'll put my info in the chat. If anyone has youth that they work with and want something for them to do, I'd be happy to work with you.
Thank you. E. Lee. Oh, you're muted.
Right. Hi,
There you
I'm
go.
Elizabeth Lee. I'm a family nurse practitioner, and I'm with the Villa Veritas Foundation. It's a rehab recovery center for substance abusers. I just wanted to inform everyone, this just came out in August, that the Narcan nasal spray has an extended shelf life for 3 years after the expiration date. So that's one thing. The other thing is that I wanted to tell you that in New Paltz, I organized a voter drive-through in which people can get voter registration forms and application for absentee ballots or have their questions answered about the election. So that's going to be from September 12th on every Saturday from September 12th to October 17th from 1 to 4 p.m. if anyone's interested.
Great, thank you. Let's see, so Wendy Detweiler.
Sorry, I was just trying to put it back on. My name is Wendy Detweiler, and I'm an intern with the Jewish Family Services, and I'm brand new there, so I'm not aware of a whole lot of things that are going on. I do know that my supervisor, Sharon Cohen, has reopened their building for doing background checks and fingerprinting, so I know she's extremely busy with working on that, and so I haven't gotten to have a whole lot of in-person contact because I know they're still trying to hire people to take over those services for her. So that's all I really know.
Thank you. I'm Katie Sheehan Lopez.
Okay, hi. So I'm Katie Sheehan Lopez. I am the SNAP-Ed nutrition educator in Ulster County. So I am available if you have any groups that are able to meet virtually. I can provide nutrition education to any age that is eligible for or receiving SNAP. And that would be anywhere in Ulster, Greene, or Columbia counties. So if you have a group that you think would be interested, please reach out to me, and I'm gonna put my info in the chat box. Thanks.
Great, thank you. Let's see, Cindy Noble. Cindy, you have to unmute. There you go.
Christine Noble.
Oh, I don't know why I said Cindy.
That's okay. That's okay. I've been here a little while. I'm senior AV
you
services
have. That
aide here.
was something, I don't know.
No worries.
Whatever.
Yeah, well, when I'm at my desk at work, it comes up C Noble, so it doesn't put my full name unless I've been working a lot from home lately. So at any rate, right now our office is giving out farmers market coupons to eligible seniors, 60 and older, and there's an income limit for for them that they can come to the office and just let us know they're here by the guards, and they'll come get us, and we give them out by the front door. We were doing it every Friday, but that's stopped. But we have a lot left, so if you know any seniors eligible, if they get food stamps, they're eligible for farmers market coupons. It's $20 worth of coupons they can use at the local farmers market, so it's really worth it. We've also been doing a lot of online Tai Chi classes and presentations like dietitian speaking about different nutritional things people can do right now while they're home, and the scams that are going on the phones with seniors while they're hunkered down there at home. So, and all of our hot meals have become frozen meals during this time. So most of the seniors are getting 1 day, 5 days, once a week of frozen meals. But our case managers are still doing virtual work from home, calling and doing needs assessments and for seniors. So personal care assistance, if they need the lifeline or a home delivered meal, they can still call and we can help them with that. So other than that, I mean, even our lawyer, if anybody needs a will done or a power of attorney, durable power of attorney, healthcare proxy, they can still call, and the lawyer's doing it from her office. So a lot of our services are Medicare counselors. They're still working virtually, so you can call in and they'll call you back and do it all over the phone. So we're still kind of operating, virtually or through phone calls. So anybody that needs us can still call, and we're trying to help as best we can. That's basically it right now.
Thank you so much, Christine. Melanie.
You're welcome.
Penalosa.
Hi, everyone. My name is Melanie. I'm a Wellness Resource Coordinator at Mental Health Association. I would say the one thing I would like to highlight are our support groups. They are now all available by Zoom. We are offering a coping with anxiety and depression group that meets twice a week, Wednesday afternoons and Thursdays. And we have a group for those who live with Parkinson's disease, those who have thoughts of suicide, as well as eating disorder support groups. We offer 2 of those, one for those who restrict calories, and then one for those who tend to binge eat. And new this year is a bereavement support group. That one is specific for those who have lost someone to an overdose, and that starts next Monday, as well as our anger management groups. Our men's anger management group starts tonight, but for those who would like to sign up for that, they do have to contact us to do a screening. And we normally do also have one for women. It's just as of right now, we don't have an official start date for that yet. But if you have any clients who are interested in joining the groups, all they have to do is contact MHA, and they could speak to either me or Jenna. And all that's required is that they sign a consent form, and then we can give them the codes. But our groups are completely free, and they're drop-in. They're not like mandatory every week or anything. It's just for them to utilize. But yeah, I mean, that's basically our most major update.
Great, thank you. And remember, you can put some of your information in the chat as well. Noah and Meza,
sure.
I'm not sure I said it correctly, but your turn. And please correct me if I didn't get it right.
Hello, everyone. This is Nohan. Can you hear me? Yeah, no?
Yes.
So hello, everyone. I'm Nohan. I'm an editor for La Voz magazine. For those of you that don't know us, we're a print Spanish language magazine in the Hudson Valley. We distribute our magazine in 8 counties: Ulster, Orange, Columbia, Sullivan, Putnam, Greene, and Rockland. And we don't really have anything in the way of events right now because we're a magazine. But we just wanted to, inform everyone that we're running as usual. If there is any particular need that you have regarding the Spanish-speaking community in the Hudson Valley, please reach out to us. If you have any kind of resources that you would like to share with our community, please reach out to us. I've put information in the chat, and that's about it. Thank you.
Thank you. Kristen Kessler. Kristen, are you muted still? Okay, we're going to move on to M. Kappa.
I think it's Myrna Capaldi.
Thank you.
Hello, everybody. I am a certified New York State of Health navigator through the marketplace. And right now we're just trying to get everybody insured. We do Medicaid, the essential plan, and all kinds of health insurances. And we serve Ulster, Dutchess, Sullivan, Orange counties. If you know anyone that needs to be insured, send them to 7 Grand Street where we're located. And we also speak Spanish.
Awesome. Thank you so much, Myrna. I'm also going to give Sophia, do you have anything to share on behalf of your organization that you didn't get a chance to in your presentation that's coming up? Or
Yes, actually, Hudson Valley Hospice also does provide free grief and bereavement support groups. And we have groups that are, actually we're trying to start a group right now in Ellenville, working with the Ellenville Library with that. We also have a group in Kingston in coordination with the LGBTQ group organization there. So if anybody is interested in learning about the groups, you can feel free to contact me or call our agency, and I'll put the general number up as well. And those are free for whether somebody's utilizing hospice or not. So please reach out. Thank you.
Thank you. Kristen Kessler, are you there? We'll give you one more shot at sharing. Okay, Courtney, do you have anything to share on behalf of AG?
We're waiting on a small amount of hand sanitizer and masks for any farmers that are in need. And if there is a farm or farmer that may need them, just reach out to Christian or I.
Thank you very much. Stacy Kraft.
Hi there. I'm just trying to share my camera, but these weird buttons are popping up when I try to show my camera, but hopefully you can hear my voice. So at the Department of Health, we're still coordinating our Healthy Ulster radio program, and Vin Martello is our host with Dr. Smith at times. So anybody on this call that's interested in being a guest, we would love to get your program information out to the listenership. And we have some good shows scheduled over the next few weeks with the Upstate Poison Control Center organization in Rhinebeck called Unshattered. And we're highlighting the Suicide Prevention Month with Dr. Jerry Fix. So we would love to include any of you. If you could just email me about your interests, that would be fantastic. And I'll put my email in the chat box in a minute. Additionally, I wanted to make sure that people knew that the New York State Quit Line, Smokers Quit Line, that is, has expanded their services to include nicotine gum now for those seeking to quit smoking or vaping, and most will qualify. So I'm going to add that detail for you to share with your clients. And thank you for all being a part of this. That's
Thank you.
Mm-hmm.
Vin Martello.
Here I am walking the Healthy Ulster talk on the beautiful Ashokan Rail Trail with my dog Isabel. Not really, I'm at my desk. In addition to all the COVID-related activities here at the Health Department, there are 2 concurrent and ongoing epidemics that have been exacerbated by COVID, and they are the opioid epidemic and the continuing rise in suicide rates, which are brought on by a lot of different factors, including all of the additional stressors and isolation that surrounding COVID. So we are continuing to work on the opioid epidemic with the HEAL team from Columbia University, and we have some staff of our own on board for that, and our internal opioid team to increase availability and access to naloxone, to sign up more medication-assisted treatment providers and make people aware of those. We're doing virtual Narcan trainings. We're working on safe prescribing practices. And we are launching, in conjunction with Ellenville Hospital, high-risk mitigation teams, with one focused on Kingston. And these teams will go beyond the immediate response to opioid overdose or what have you, to following somebody through the entire continuum of care, treatment, and recovery through a multi-year process, and really close-in follow-up with a database surrounding it that's designed to not allow anyone to disappear from everyone's radar screen and slip into the cracks. On the suicide front, we are, this is National Suicide Awareness Prevention Month. We are getting information out about that, and we are now planning to have a summit, countywide summit, similar to the Domestic Violence Forum in the spring, whereby we bring in speakers, people with lived experience, question and answers from the audience, and really trying to really ramp up the awareness of suicide, and more importantly, what people can do to recognize it in their friends and loved ones and prevent it.
Thank you. Did I miss anyone in our networking sharing? Everybody had a chance to share? Okay. So I want to thank everyone so much for coming to our Healthy Ulster Council meeting. I just want to share my screen one last time. Just going to put this up here and move us along. If I can get it to move along. Let me hear from current slide. There we go. So mostly I just want to make sure that you know our next Healthy Ulster County meeting will be held Thursday, November 12th, 2020 from 2 to 3:30 p.m. again on Zoom. So watch for another meeting invite. Be sure to visit healthyulstercounty.org for more information and for meeting notes. And if you need to contact us ahead of time, you can reach out to me, and my email contact is there, or Stacy Kraft, and her email contact is available as well. It would be great. One of the things that we have not been able to do very successfully after these meetings, which we have done always, is get sort of an evaluation of how our presentations are important to you, or you know, have an impact on your work or your personal life, whether they do or they don't. So I'm just going to leave this screen up for a minute in case anybody needs contact information. And I can put our emails also in the chat, but I want to just take this last moment, first of all, to give you an opportunity to put any questions in the chat or any comments. But I do have a short poll just before you leave to fill out, and it's just a brief evaluation of each presentation. Was it important to you in your work or your personal life? Of course, you know, we have, with all of our work right now, technical difficulties. It's really not about evaluating technical difficulties. This is about evaluating the topic and how that you know, relates to your work or your personal life. So I'm going to put that up there, and if everybody could just complete that quickly. I think it's 7 short questions. I'm just going to launch that, and you basically have a chance to fill out the questions. You should see that on your screen. Does everyone see it? Yes. Okay. So just have a quick, we'll give you the first question. I'm assuming you can scroll through them.
So Melinda, it says attendees are now viewing questions, and I can see them, but
You can't take it. Right. That's what I'm seeing here too, and that's interesting. So you're not able to answer. Well, that's in my error. We'll work on fixing that. I think maybe what you could do in lieu of this, being as you're unable to answer the questions, there's not a box for you to check, unfortunately. Oh, Stacy says she can. So I guess it depends on what you're seeing. If you're able to answer answer the questions, that would be awesome. If you are not, it would be also valuable for us just to list the presentations that were most valuable in the chat. So we had the presentation on COVID, information for testing. We also had a presentation on getting the census out, and we had a presentation on hospice, and of course we had our networking. So those are the 4 parts of the meeting. And yeah, some people are able to do the survey, but if you don't see it in the way that you're able to, it could be because you're a co-host, Katie. I'm guessing you're seeing it the way I'm seeing it. Anyone I made a co-host might have difficulty. But if you can't answer the questions, just put the presentations that were valuable to you in the chat. So. Okay. Awesome. So yeah, I think most everyone was able to answer it. It really had to do with probably the fact that you're a co-host on the meeting. You're seeing it the way I'm seeing it. I'm just going to give you a couple more seconds. I see we're down to the 7th question. Going to take a little bit more time. Okay, so yeah, some people had it closed for them. This is sort of an imperfect thing, and honestly, it's the first time I've used it this way at the end of a meeting, so it could very well need some perfecting. So this is my technical hurdle. But again, if you were unable to, just type in the chat what was the most important presentation to you, so we have some idea and how relevant things were in your life. But we do have, we are getting answers on most everything. So I'm going to basically close the poll, and there we go. And we're good. So thank you again for joining us. If you want to be a presenter at a Healthy Ulster Council meeting, please reach out to me and we'll try to put you on our schedule. And thank you again for coming. I so appreciate it.